Hello and welcome to Health Talk. I'm your host, Angela Baroco Eddy, and today we're doing a tour of the Endoscopy Center, a state-of-the-art medical facility that's located here in Pensacola, Florida. Typically our show is done in this studio, but today we want to give you a behind-the-scenes tour and have you meet some of the staff that you may see when you come here for your appointment. So let's get started. Let's go in and see the Endoscopy Center. Inside the Endoscopy Center. We're in the main lobby, and with me is Mr. Steve Dunn. He's the administrator here at the Endoscopy Center. And Steve, the Endoscopy Center has achieved a very high recognition award, the Center of Excellence.
Yes.
Tell us a little bit about that.
Okay, actually the American Society for Gastrointestinal Endoscopy is one of the three groups that work with gastroenterologists around the country, providing additional information, new literature, but the ASGEs focuses on providing, standards for quality of care in the gastrointestinal field. They have inside of the ASG the Endoscopy Unit Recognition Program. That is a very high mark that a lot of endoscopy centers strive for. Not everybody reaches it. There are about 17 in the state of Florida. There's only one in Northwest Florida, and that's us. It just means that we worked, very diligently to achieve a very high standard of quality of care, and that there are a few things that we do that others may not to reach that mark.
And that is such an honor, and congratulations to the whole Endoscopy Center for that. But it's an honor for Pensacola too to have you here, so we appreciate that very much. So again, we're right here in the front entry when people first come in. What can they expect when they first come in the main doors?
Well, hopefully they'll get greeted very, welcomingly by one of our front desk people. Then they'll have to sign in, and we'll call you back up, and you'll have to fill out a lot of forms. Unfortunately, that's paperwork is one of the common things that you'll see in all healthcare, and we have HIPAA consent forms, and we collect your demographic information, where do you live, what's your phone number, information like that. One of the things we frequently have to, we get asked about is, well, why do I have to, say why I'm married or why I'm employed? Well, the Agency for Healthcare Administration, the state agency, requires us to ask those kinds of questions. But all throughout the whole process, everything that we do, when we ask you your name again and again and things like that, one of the reasons that we do that is all ties back to patient safety. Everything we want to do, we want to push patient quality of care and patient safety throughout the entire process.
And again, having those high standards is one of the things that has gotten you that recognition of the Center of Excellence. So it's something that starts as soon as you walk in the door.
Absolutely.
So that's a very good thing. When the patient leaves this area, where do they go next? And that's where we're going to go next.
Okay, great. The next step is you get called back by one of our admitting room nurses, and we've got one who's ready and waiting to talk to us.
Fantastic. So we're going to go back to admitting.
All right, great. Let's go.
And here we are in the admit area. Once you've left the front of the Endoscopy Center, you'll come back here and you'll meet with someone like Melinda. She's a nurse that works here in admit. Melinda, tell us a little bit about what the patients can expect when they get to this point.
Okay. We will call them back from the waiting area. We'll bring them to the dressing room. At that time, we will have them change clothes, usually into a gown. Bring them out here to one of these admit chairs, and we will go over paperwork with them. We ask about medications, patient history. At that time, we talk about any concerns they have. The new people that are coming in have never had a procedure. We go over kind of step by step what we're going to do, make them feel a little bit better. And once our paperwork's done, we will get an IV started on them. That's to get them ready for the anesthesia. Anesthesia will come out and talk to them before they go back. They have another consent for them to sign. And at that time, any concerns we have, we'll go over with them, and any kind of safety, go over, of course, any kind of history and all for their safety, and then have them ready to go back to the procedure room.
So here is where they can ask all the questions they need to. When they have those things that they've been wondering about, not quite sure, and a little bit hesitant, you're the one they ask.
Right. And we go over anything, their big concern is going back to the procedure, and they've never had it. They have that fear of what's going to happen. So we will talk them through it, tell them exactly what's going to happen, so there's no surprises once they get back to the procedure room.
Fantastic. And so from here they go to the procedure room, so that's where we'll be going next. Thanks, Melinda.
Your word is gastroenterologist.
Can I have the definition?
A physician who specializes in diseases of the digestive tract.
Can you please use that in a sentence?
When stomach pain persists, you should see a gastroenterologist.
Could you tell me where I could find one?
The Endoscopy Center on North Davis Highway has a highly trained staff of 12 gastroenterologists who are ready to serve all of your gastrointestinal needs.
G-A-S.
Your first date. Your first job interview. Your wedding day. Your first baby. The firsts of everything can be scary, but you survive. Your first endoscopy may increase your chances to survive. Colon cancer screenings can save your life. If you won't do it for yourself, do it for the ones who love you.
The Endoscopy Center of Pensacola is an ambulatory care center designed with the patient in mind. Conveniently located on North Davis Highway, the center specializes in outpatient endoscopy. This is the direct visualization of the digestive tract with a video camera. Several different types of procedures are performed involving the esophagus, stomach, small intestines, rectum, and colon. All procedures are performed by board-certified gastroenterologists. Ask your doctor about the Endoscopy Center or call 474-8988.
So after a patient leaves admit and they come to the procedure room, they'll come to a room like this and they will meet someone wonderful like Georgianne, who's a registered nurse here at the Endoscopy Center. Georgianne, tell the patients a little bit about what they can expect from the time they walk through that door.
We go and the nurse and the technician will go and get the patient out of the admitting area, and we'll bring our patient into the room. We'll ask them to get on the gurney and get comfortable. We'll then hook them up to our monitoring equipment where during the full length of the time in this room, we will monitor their blood pressure, their pulse, their oxygen saturation, and we have an EKG, have them hook up to an EKG. That way the whole time that they're asleep and throughout the whole duration of the procedure, we will be monitoring and watching the patient very carefully.
So they come in, they're awake, obviously, they lie down, you talk them through all of those things and hook them up to everything. Then what happens next?
The doctor will come in. We'll have our nurse anesthetist who works directly under the anesthesiologist. We'll have our gastroenterologist come in. They'll greet the patient, and then we will begin the sedation. We'll have the patient roll to their left side, and then we will start the sedative. The nurse anesthetist will. And that usually the patient will be asleep in about 20 seconds. And the patient takes a wonderful, comfortable nap, and then we begin the procedure. Now we do the colonoscopy or an upper endoscopy, depending on what they're here for.
And the two things are very different, obviously. So let's talk a little bit about those two procedures. Just in general, what's an upper endoscopy?
The upper, for an upper, we will put a bite block, a safe bite block before the patient goes to sleep, right before, to protect the patient's teeth and protect the scope. And the doctor will gently slide the upper endoscopy scope over the back of the tongue into the esophagus, their swallowing tube. Go down into the stomach. He'll be able to look around. If he sees any reason to take biopsies, he can do that. It's not painful at all to the patient. These procedures are very, very comfortable. Then we'll go into the first part of the small bowel and take a quick little peek, then come back out. The scope time for an upper endoscopy is maybe 5 to 10 minutes. It's very quick.
Very quick. And then the other procedure that could be done here is a colonoscopy. Let's talk about that just briefly. What briefly is a colonoscopy?
After we are sure that the patient is comfortably asleep, we will, this colonoscopy, they'll insert the colon scope and be able to go the full length of the whole colon, all the way to where the colon begins. You think it would be at the end, but it goes all the way to where the colon begins. He can take polyps, he can take biopsies. If there's any issues as far as colitis or anything like that, he'll be able to see that and take biopsies.
What is one of the questions that you get asked most often here in the procedure room?
A lot of times while we're waiting for the doctor to come in, the patients may ask, what difference is there in the scopes? The upper scopes are a lot shorter and they're a lot smaller around. Their diameter is less. And the colon scopes, of course, are going to be longer with a little bit of a larger diameter.
About how long is the colon scope? That's something that always seems to surprise people.
They're probably about 4.5 feet long. However, that does not mean that the full length of that scope is needed. Everybody's colon is different length, different size. So usually we'll go in maybe about 3 feet.
3 feet or so. So after the procedure is done, once the scopes have been removed, then what happens next?
When we're all finished, the patient is still asleep, very comfortable. We then will take our patient into the recovery room while they're still asleep. When they stop titrating the medication, the patient will then start to wake up, usually within 5 minutes of the medicine and the procedure being over.
Why is it so important that someone come in for just a screening colonoscopy?
Colon cancer is one of the cancers that can be prevented by having your colonoscopy at the age of 50 is what's recommended, because all colon cancers can start as a polyp, and polyps are not going to show any symptoms. And so what we'll do is we'll remove the polyp, and you don't know which ones are going to turn bad and turn into something really terrible later, or just sit there and do nothing. So we take the polyp to hopefully avoid the colon cancer. So it's very important to have this procedure starting at age 50.
Very, very important. Again, it's a preventable cancer, so if you have these screening colonoscopies done, your chances of having colon cancer are almost none.
If someone in your family, the closer the relation, the higher the risk, has colon cancer, you would want to start that like 10 years before. Like if it was discovered in a family member at 40, you'd want to start it earlier, like at 30.
So again, the family history and all of that comes out when you're doing the very initial questions and you're talking about the family history when the patient very first comes in. And then you can assess those risk factors and things like that and make sure that it's all taken care of.
It's a very simple, comfortable test that can save your life.
There you go. I don't think you can say it any better than that. So again, from here we're going to head into the recovery room. So that's where we'll see you in just a minute. So after the patient is done in the procedure room, then they'll come to the recovery area and they will meet someone wonderful like Heather. Heather is one of the nurses that works here in recovery. And Heather, tell us a little bit about what a patient can expect once they get here to the recovery area.
Well, we'll bring them out into recovery from the procedure room. They'll be asleep. We'll hook them up to the monitor. We'll monitor their blood pressure, their pulse, and their oxygen. And mostly they're just asleep while they're out here. And
about how long do the patients stay asleep once they get here? And I know it's different for everyone, but just on average.
It's generally between about 15 and 30 minutes. We just give them the time that they need to wake up and make sure their vital signs are stable before we send them to discharge.
And to make sure their vital signs are stable, what do you have to do for that? You just take them out, obviously, when they wake up, and then do they have to be awake for any length of time here before they move on to the next area?
They have to spend at least 15 minutes back here with us, but we watch the monitor to make sure their vital signs are stable, and then we watch the patient as well. Just make sure they're communicating with us, you know, like they should. We give them something to drink and make sure they can swallow and tolerate that well. Make sure they're not in any pain.
Is there anything else that needs to happen with the patients before they're able to move to discharge area?
If they're in upper endoscopy, we like for them to have something to drink to make sure that their swallowing is fine. And we also like them to pass some gas. They fill you full of air with the scope to expand your colon during the procedure so that they can get a good look around. And so when they come out into recovery, they're generally full of air, and they have to spend some time getting rid of that air so they're not uncomfortable when they sit up.
And that's important, and I think that that's something that people might be a little bit uncomfortable about, but they don't know that you guys see that all the time.
No, there's no reason to be embarrassed about it. We're used to it.
You have to be.
Yes,
You have to do it
yes,
because when they pump you full of air, it's got to go somewhere.
Definitely.
And if it doesn't, then you're going to be really uncomfortable.
Right.
So after they've spent some time here and they've been asleep for a while, you've monitored everything, they've awakened, they're feeling fine, they've either had something to drink, they've passed whatever gas they need to, then what happens next?
We assist them to get dressed because they're still a little light on their feet, should we say, from the sedation. So we help them get their clothes on, and we safely move them to a wheelchair, and then we just wheel them around to discharge so the doctor can talk to them and they can be reunited with their family members.
So here there's a team of nurses that works with them to monitor them. Are they seeing the same person over and over, or do they have different nurses that are coming in to talk to them when they're here in recovery?
Generally it's the same nurse. We're assigned to a certain doctor and we work with the certain doctor's patients, each nurse.
Perfect. So that way they know who to expect, and they'll know when they wake up they'll see a different face than maybe they saw in the procedure room, but they'll see the same face
while they're in recovery. Yes,
perfect, perfect. So I think our next stop then is discharge. So we're going to head out from here, and Heather, thank you so much, and we'll see you in discharge.
Your first date. Your first job interview. Your wedding day. Your first baby. The firsts of everything can be scary, but you survive. Your first endoscopy may increase your chances to survive. Colon cancer screenings can save your life. If you won't do it for yourself, do it for the ones who love you.
The Endoscopy Center of Pensacola is an ambulatory care center designed with the patient in mind. Conveniently located on North Davis Highway, the center specializes in outpatient endoscopy. This is the direct visualization of the digestive tract with a video camera. Several different types of procedures are performed involving the esophagus, stomach, small intestines, rectum, and colon. All procedures are performed by board-certified gastroenterologists. Ask your doctor about the Endoscopy Center or call 474-8988.
We're going to take a quick break and talk about something that's very important that a lot of people wonder about. They may not ask about, but they all wonder. And we're going to talk to Joanna, who's the Director of Nursing here at the Endoscopy Center. Joanna, tell me about the scopes. What happens? How do we know they're clean? What happens after the procedure? Talk me through it.
You're right. That's a big concern patients have about how clean are our scopes, because there have been things in the newspaper or different other areas that didn't follow our standards, and we are a center of excellence. So we go above and beyond what is nationally required. We go above because we want our patients to be safe, to know that they're having high-level disinfected scopes used on them every time. They're processed and cleaned consistently the same way every time, so they can be guaranteed a high-level disinfected scope.
So tell me a little bit about that process.
Okay. After the physician is through with the scopes in the room, we do an initial cleaning in the room. Then we transport the scopes to our scope processing area. It has automated wash machines that are specially designed for scopes. So we use the upper scopes for the EGDs and the colonoscopy, colon scopes for colonoscopies, and we manually clean them in the scope room, all the channels, all the accessories that we've used on that patient, and then we'll put them in a wash machine that goes through this high-level disinfectant. It air dries everything. It tracks. We actually have a piece of paper that we can track that scope that has gone through all the processes it needs to be, which scope was used, and that it had a complete cycle on its disinfectant, so the patients can be guaranteed that they have a disinfected scope.
So you actually have a paper copy that's the history of the disinfecting
Yes.
of each scope.
Yes.
So again, it goes right along with, as you said, the center of excellence, the high quality of care, patient safety, all of those things that are, again, as you said, above and beyond what is required.
That's what I'd want if I came to a center.
Absolutely, that is what I would want too. So thank you so much for explaining that to us, and I know that we've got some great video and some tape of some of those areas too, so that's something that they will be looking at as well. So again, if you come to the Endoscopy Center, you know you are always assured that you will have the highest level disinfected scopes that are used anywhere. When the patient is done in the recovery area, the next place that they'll go is discharge. And so in the discharge area, they will meet someone like Scott, who's a registered nurse. He works here in the discharge area. Scott, tell me a little bit about what a patient can expect actually from the time they're leaving recovery.
When they leave the recovery room, they come around the discharge area. This is the last area that they'll stop as they're getting ready to leave the building. We have 6 discharge rooms, and the recovery room lets us know when they're ready to come around, and then we get the family members of the patients. We bring them to the discharge rooms and place them in the room prior to the patient getting there. The patient will come around in a wheelchair, and then once we have the patient and the family member or whoever the driver is that's with them in the room, then we let the doctor know that they're ready to be talked to and given their instructions before they leave.
And it's very important that someone is with them at all times. Is that correct?
That's correct. If the driver has to get up and go use the restroom or something, we have either one of the nurses or the nursing assistants come and stay with the patient because they have been sedated and they're in a wheelchair, and we don't want them getting up out of their wheelchair.
And about how long does someone stay in this discharge area? And I know that that's a loaded question because the times are different for everyone.
Yes, it really varies. Usually maybe about 10 to 20 minutes. Their family members are brought back here. They're usually here a good 5 minutes before the patient comes around. And then it all depends. We drop a note off at the doctor's desk saying that this patient is ready to be discharged, and we have to wait for them to come out of the procedure that they're currently in. When they come out to their desk and they know that that patient's ready to be discharged, they will come in here and discharge the patient.
And that's always a little bit tricky because, again, we've been talking throughout the program about the highest standards of care, and that's something that's very, very important. And it's hard sometimes to recognize that when you're waiting for a doctor to come see you. But once you get to this point, you're sort of at the mercy of what the doctor is already doing. Is that right? They're doing another procedure.
That's correct.
And depending on where they are in that procedure, how long that particular procedure may take, that's how long you may wait, and that's why.
That's exactly right.
It's important, I think, that people know that they're not just, the doctor's not back there having a cup of coffee and just waiting to come and see you. They really are in the middle of something else. And again, those highest standards of care and the highest quality care that they can provide, they don't just provide to you, they provide to every single patient that comes through the door. So sometimes they do take a little bit longer. Sometimes they do make sure that that patient has that extra time that they need. And then as soon as it's your turn and as soon as they can get to you, they will get to you, and then they will spend as much time with you as needed, correct?
That's correct. And sometimes they may see more than one patient as they come out in between procedures if they got 2 or 3 ready to go. So they'll see all of them at once, answer all their questions. They leave any instructions that they have for us nurses as far as scheduling appointments, follow-up appointments, brochures that they want them to have, things of that nature. They give us those instructions, and then when they're done talking to the patient, then one of the nurses comes in and goes over all those instructions with them prior to taking them all the way out the door in a wheelchair, all the way to the car pulls up to an area right outside here, and we wheel them right to the car and help them into the car.
And what sort of things might the doctor discuss when they are in here with the patient?
Well, they'll tell them exactly what they found and kind of hopefully be able to point out on some of the diagrams here that we have in each of the rooms, and tell them how they can go about following up, getting their results, things like that. We have all that written down on our discharge instructions as well, as far as following up on their biopsy results or
So if they've found anything, they'll explain what they've found. They'll explain all of the different things that you need to do next.
Right.
And then they turn them over to you guys, and you can get them out the door.
Right, and some of the doctors even like to give their patients copies of the pictures that they've taken. Some of the patients like to see, they're more visual, and so we do get copies of that as soon as the pictures are done in the procedure room. They print off right at the discharge desk, so the doctor also has those to access and to show the patient what he's talking about.
Pictures of your insides. Can't get any better than that. So from here, you're done. So once you're finished at the discharge area, they take you out to the car and make sure that you've had a great experience. And again, it's one of the best experiences in town. If you have to have this procedure done, there is no better place than the Endoscopy Center.